Okay, Mo. Right, we'll do some introductions.
Yeah.
Hello everyone. I'm David Hill. I'm part of the community rehab team at Pennine Care. My role in the team is I'm a peer support worker, and
Hi, hello everyone. My name is Mohammed. Um, I'm a prolific author, mental health campaigner, and advocate, and I'm very passionate about mental health.
great. Yeah, we're thrilled to be asked to do this today. It's a great honour. So, Mo, one of the things that I guess one of the questions was just to talk about your experiences of mental health services. So maybe kind of like talk about, when you became ill and became an inpatient and maybe sort of quickly summarize that journey.
My journey has been a long one. It started almost 17 years ago when I first became unwell, and at the time I went through some strange things. I used to see supernatural things. I used to see birds flying around everywhere, giving me instructions. And I'd see crows, magpies, pigeons, seagulls. It was a strange time. It was like a whole different language. Um, and I used to like the color red, sorry, the color white, and I used to hate the black color because for me at the time, black represented evil
Okay.
and white represented purity and goodness.
Right.
And that was the start of my 17-year journey in the mental health system because I was eventually police got involved and I was sectioned under section 2, and that was my first admission, which is over about 17 years ago.
Yeah.
And since that time, I've been in and out of hospitals, as they call us, revolving door patients.
Yeah.
So I've been in and out of hospitals throughout this 17-year period, and I've spent over 10 years hospitalised and detained in different units across Greater Manchester.
What's that feeling of going into a different unit and everything feeling unfamiliar? What's that like for you?
Like obviously, on your first admission, you have the trauma of being sectioned,
Yeah.
being dragged away from your own home by strangers, or maybe even with a police escort sometimes, depending on the situation. So there's that trauma, and then there's the trauma of leaving home and being forcibly detained in a hospital setting where it's a different regime.
Yeah.
In the hospital, you have to get used to, taking medication. You've got to get used to, needing Section 17 leave to go out to the shop or for a walk or
So it feels quite restrictive.
It's very, very restrictive. But obviously, I'm talking about acute ward here.
Yeah.
I've not really been in like secure units, except maybe PQ.
Yeah.
I've actually been to a PQ a couple of times.
Okay.
But your first admission, your first experience, it can be very harrowing. So that's a appropriate word. I think
Yeah.
It can be quite harrowing because one of the major things is having to start taking medication and getting used to the hospital routine.
Okay.
So initially I was in hospital under a section 2, but then that got changed to a section 3,
Okay.
and I ended up in hospital on my first admission for 1 year,
Right.
almost 1 year, and then I've had four admissions following on from this, all very long admissions. And my latest admission was into a rehab unit in Stockholm.
Yeah, I was gonna. So, when you went from acute to in rehab unit, what was the difference like going?
Yeah.
Maybe talk about that in a bit more detail. How that felt, the differences between the acute.
I mean, the acute ward, you see the doctor much more often, whereas in the rehab ward, you see the doctor once a month.
Okay.
That's one difference. The rehab unit, I think, is a bit more flexible than acute wards in certain aspects. But the rehab unit that I was at, I've hats off to them. I just want to say that
Because that was Heathfield House, wasn't it?
Heathfield House.
But
They were amazing people, amazing staff.
Yeah.
You had the occupation therapy team, the psychology team, the nursing team, and they all work together to support you and help you. My only qualms regarding staying at his Hill house was the sheer length of the stay.
Yeah, because you went in the name rehab kind of gives the impression that you're on this journey of recovery.
Yeah, yeah.
And you said that when you went to Heathfield, you were given this expectation that you'd be there for a couple of years, and you felt like you were sort of, I won't say missold, but it was much longer than that. And you've reflected back that one of the things about your time in the rehab unit was that you were expecting to move on, but the timelines kept getting pushed back, and you weren't. It wasn't explained to you, was it?
Yeah, I remember when I first went to the rehab unit, I was told by staff at the acute ward before I moved to the rehab unit. I was told by staff that the average stay is about 2 years.
Yeah. And how long were you at Heathfield for?
And I was in Heathfield for just under 6 years.
Right.
And that was 6 long years, And there are times when I do think about all that lost time, all those valuable hours, valuable days, valuable years, where I did absolutely nothing. Not just me, but everyone on the unit. I did nothing. Although we used to have like football group, we had snooker club, we had cooking club. Uh, but when I say activities, I mean things like educational courses. I mean more productive things.
You feel like some of it, you talked about before, like it was a wasted time in some respects. You could have achieved more in that rehab environment.
I could have definitely achieved more.
If you were given the opportunity, or
if I'd had the opportunity, I would have probably done a degree. I think I've got the potential and capability of getting an online degree without doubt. I could have learned a language. I'm passionate about languages. I know 3 languages, so I could have learned a language.
Do you think having more opportunities during that rehab stay would have aided your recovery? And do you think it would have speeded up your journey out of the rehab inpatient services?
I think so, Dave.
Yeah.
I do think so, definitely, because that would have kept me occupied with something productive, and it would have stopped the rumination and bad thoughts and the voices that I hear. Obviously, the voices come and go, and I don't think they're ever going to go away. It's very unlikely that will happen. So I've come to accept my voices, and I'm resigned to a life where I will probably keep hearing it. So it's a part of me, and I've accepted it now.
One of the other questions that they were keen was just talking about the work we've done with community rehab and how that support, in terms of now you've moved from the inpatient rehab unit to a supported living environment. We've often talked around, and you've been out of Heathfield for almost a year. Do you think the support that community rehab are giving you has helped you to stay as well as you are, and the journey being so positive for you?
Yeah, without doubt, definitely. Because the previous discharges from hospital, I've been visited by the home treatment team for maybe 2, maybe 3 weeks, and then you just left to your own devices. However, this discharge has been very different because I have intense contact with the CRT, the community rehab team, including my psychologist, who's part of CRT, and I get to see my support worker, which is Dave here. So there's been intense contact with the team.
Because we talked around how you could go from that rehab environment at Heathfield where there was lots to do, and then you just said, you could come where there's nothing, and that transition can be quite unsettling.
It can be.
And it was initially here, wasn't it? Because you felt like when you arrived, it took a while for you to adjust to this environment, didn't it? The change from, like you talked about how it was a locked door environment at Heathfield, and then here you've got much more freedom, and it took you a while to adapt, didn't it?
It did. I mean, when I first came here, I found it difficult to go out of the building without getting permission. But I was told by staff that you can come and go as you please, as long as you let us know where you are. And if you're going to be late, you just get in touch with us. So I found it really difficult because obviously 6 years of can I go out now, please? Can you sign my 10-point safety check, please? Can you check my section 17 leave, please? So it was a big jump from a locked environment to an open environment, and they do have activities here, but again, one thing that is lacking, in my opinion, is the very same thing that I mentioned earlier: lack of productive educational activities. Um,
So yeah, I mean, the last sort of question we kind of covered in some respects, but I think it's where you've talked around feeling like you're achieving something with the time that you're in those services. So we talked around, some people. I mean, you are a good cook, but some people might go in and could come out if they were taught skills around cooking, or they might have gone in without any qualifications and could utilise that time by coming out with qualifications. So you think that's something that the improvement could be offered?
Yeah, I mean, I do believe that it's very, very important across, the different trusts across the UK. I think it's important to offer courses, like you said, they did. Maybe even GCSE courses where a person might go into hospital for a year and they can get learn GCSE level knowledge. And I think it's so important that at the outset, from the onset of when a person is detained in hospital, it should be made clear the approximate time that they will actually spend in hospitals. I think this is very, very important. And like you mentioned about cooking, I think life skills can be taught, such as cooking, and there needs to be education about a healthy diet and lifestyle as well.
Talking of time, though, we are over our time, like we always are.
We always are, exactly.
We'll bring it to a wrap, shall we? But thanks very much for inviting us to talk, and
thank you very much.
Thank you.
We hope it's beneficial and it's educational and informative.
Thank you.